Good morning, my listeners and my viewers. We are going to look at another very interesting topic called advocacy in primary health care. Advocacy. Before we look at advocacy, who is an advocate? An advocate can be seen as somebody that stand in between another person and the government or a philanthropy or any other person to portray the interests of the people. Anybody that relates the interest of others to the higher authority is an advocate. Advocacy simply means giving support to a cause. It also defined as a set of action undertaken by individuals or organizations working in partnership to build consensus, gain support, or create a favorable environment for introducing or changing specific strategies, programs, laws, or policies. For example, when a community lack good water supply and you take the matter of poor water supply or bad water to relevant authority or the government for them to bring to drill borehole or to dig well, you are an advocate. And what you are doing is called advocacy. Or when the community is having a disease, there is a disease that is disturbing the community. When you relate the issue to the government and stating to them about the need for them to come in for the treatment of this disease or for the prevention of the spread of the disease, what you are doing is advocacy. The nurse, one of the work or importance of nursing is advocacy. A nurse is an advocate. They are advocate. The nurse either works directly on behalf of a patient or intercede for him. Example, the nurse who lobbies in a legislator to support a program which benefit the consumer of health function as an advocate. When you lobby for intervention or for prevention of a disease, you lobby for the patient, you are doing advocacy. This is also applicable to a nurse who seeks specific service of other health practitioners on behalf of the patient. The health worker who intercedes for patient by helping him or her obtain services from various community agencies. The nurse who interprets patient's need to his family. Also, the health delivery plan, total health care, and articulate the service of all disciplines represented in health care team. In other words, advocacy means to defend the right of patient or clients. When you defend the right of a patient, or client you are doing advocacy. The nurse advocacy is a dynamic process, and every health worker must be involved. It's a dynamic process. It's not meant for one person. Therefore, to function efficiently in the role, the nurse or health worker should be fully aware of the state laws governing practice in healthcare fields and the employing institution policy and procedure in relation to incompetent, unethical, or illegal practice. The nurse should know the ethics, or every member in the healthcare team must know the ethics in the health profession. What are you supposed to do in the health profession? What are the things that is due for patient? The things, the right of the patient. Make sure that their loyalty to an employing institution or colleague does not compromise their primary commitment to patient or client. If everybody knows what he's supposed to do and the right of a worker is being marched upon, you can make an advocacy role to bring a justice or to bring justice to that person that is marginalized. Give priority to the good of the individual or patient rather than the good of the society in general. The client is the most important person in the community as far as the health is concerned. The patient is the most important. Many people come to the hospital, or many people are involved in taking care of the patient. The nurse, the doctor, the pharmacist, sometimes even the patient relatives participate in the care of the patient. But the most important person is the patient. The patient is the most important person in the health team. So you must set up a priority. Prioritize his needs. What are you supposed to do? Carefully evaluate the competing claims of the patient, the client autonomy, self-determination, and patient well-being. When respecting autonomy, the health workers respect and support the patient's right to make decisions. When promoting patient's well-being, the health workers act in the best interest of the patient. Ideally, both autonomy and patient's well-being are promoted in every nurse-patient interaction. Steps taken during advocacy process. What are the steps? The first one is analysis. Proper and understanding of the subject matter for which advocacy is done. You must understand the subject matter for which advocacy is done. The strategies. Identify and clarify issues. Mobilization, build partnership. Developing partnership and identify allies towards greater support. Select audiences, beneficiaries, partners, decision makers, and adversaries. Develop messages centered on goals, including advocacy kits. Determine communication channel. Prepare carefully for meetings and encounters and anticipate the needs and possible questions that may arise when you meet target audience. Monitor and evaluate. This should be a continuous process. You have to monitor and evaluate to know the progress to your advocacy. Advocacy strategies. What are the advocacy strategies? One, coalition coalition building. This is aimed at achieving alliances to broaden the support and influence of the significant others. You have to make alliance. You ally with relevant authorities. Who will support your cause? Who is to partner with you? Do you have philanthropists around that can help in provision of health care? Identification of potential opposition and development strategies to address plan. What are your potential opposition? Do you have some people that may not agree with what you are talking about? There was a time they came, the state government brought did awareness on immunization against human papilloma virus. That's the virus that causes cervical cancer. Many people were not in support of this immunization. Some were contradicting. In fact, some say that it is an attempt to kill Africans. Some of us had to make intervention to that regard because the cervical cancer is a killer. And some of the people in the community are not aware of it. In fact, some say that it is a plan from the Western world to eradicate Africans. Some of the questions I made were, we have malaria in Africa, or in especially tropical Africa. Do they have malaria in America? Do they have malaria in England? You will agree with me that there is no malaria. Malaria infection is only present in Africa. So if you must bring this vaccine, you cannot take vaccine like that to America. You cannot go to America and start saying, we want to prevent malaria infection. We want to prevent malaria infection. Why will you do that? There are some people that are opposing effective advocacy. Even when you are advocating, some are bringing from, let's say, religious belief. Some are coming from traditional belief. In fact, confusing the unlearned in the community, so that at the end of the day, your advocacy role may not be successful. So you have to identify your potential opposition, so that you give them awareness and address the key issue. Cutting the media, you have to involve media also in information dissemination, like radio station, television station. You have to also use the churches available around, the mosques. You have to use women leaders and so on. Identification and cultivation of spokesperson or persons. You have to look for a spokesman or spokesperson that will help you to disseminate the information in a language that they will understand. Maybe you don't even understand their language. For instance, you are Yoruba and you are taking advocacy role to to a village in Plateau State, let's say Chugui. You have to get somebody in that village, Chugui, so that they will do advocacy. Organizing political support. You can get some politicians that have influence in the advocacy role. Advocacy methods. What are the advocacy methods? Visit. The first one is meeting with stakeholders. The second one, organize rallies, organize carnival float, debate with adversaries, organize other events and participate actively, press release, press briefing, testimonies, e.g. from other people, those that have benefited from the advocacy. That's the advocacy kit. You need an advocacy kit so that you will present to the people in the community. Thank you for listening. If you have any question, you can feel free to ask your question. Write your question in the comment section. Press like or subscribe to my channel. Before I close for the day, I want to give you some few tutorial questions. The first one is, what is advocacy? What is advocacy in primary health care? What is advocacy in primary health care? Who is an advocate? What are the steps or process of advocacy? What are advocacy strategies? What are the strategies of advocacy? The last question is, what are the methods of advocacy? Thank you for listening. Bye.